Hello and welcome. In this video we're going to have a look at the anatomy of the spine, hence Bob facing away from you. So let's start with some basic information about the spine. So first of all, as you're probably aware, your spine is not straight down, it is curved. And everybody's is slightly different, so you will see variations in these curves in everybody. If they become too severe, they could start to cause problems, and they've got terms like kyphosis and lordosis, and we do cover that later on when we look at deviations of the spine, so I won't go into too much detail now. But when it curves out here, like at the thoracic section, it's called a kyphotic curve. When it curves in here, like at the lumbar section, it's called a lordotic curve. The other curvature can be laterally, so spine moving away from the centre line, and that is a scoliosis, which again is a deviation of the spine that we'll look at in a later video. So don't ever expect to see this the same, and don't ever expect to see anybody's spine to be perfectly straight. Quite often there is a slight scoliosis in all of us, so it's nothing to worry about as long as it's not too extreme. So let's have a look at the breakdown of the spine. So the first section at the top here, which is your neck, is the cervical spine, and there's 7 of those. So 7 cervical vertebrae, and they're classed as C1 through to C7. You then have your thoracic vertebrae, sometimes called thoracic, and you have 12 of those, and they all have a rib attached. So that kind of makes up the main torso of your body. You then have your lumbar section. So this is the lumbar vertebrae, and there's 5 of these. This is quite often where you'll find most of your back pain issues. Lower back pain is quite a common thing. Then you have your sacrum, and that is a fused vertebrae. So there's 5 vertebrae there that are fused together. And then at the end here, your coccyx or coccygeal. So there is 4 fused vertebrae there. So cervical 7, thoracic 12, lumbar 5, sacrum 5, coccyx 4, and that's all your vertebrae. So as you can see, as you go down they get bigger. So up in the neck they're quite small, and then as you go down through the body they progressively get bigger. And again, we've talked about that in seminar on level 3, so I'm not going to go back into it for you too much. There is also something slightly interesting about your first 7 vertebrae. So each one of them has a hole through these processes that stick outside, so a forum, where the arteries can run up to help feed the muscles of the brain and the neck. So the vertebrae here, the neck one's a little hole, and I think you can see the red line runs up and takes the blood up into the head. Also at C1 and C2, these are slightly different and a little bit special. So these are known as your atlas and axis. So C2 is your axis, and it has a peg on it called the dens peg or odontoid peg. So it's a peg that sits up straight like that. And your atlas, or C1, sits on top of it. And that actually allows rotation of the head so that we can turn our heads around like this. So that's C1, 2, and that's the axis, which is C2, and the atlas, which is C1. So there you go, that's just a brief start to look at the spine. So next I'd like to look at some useful bony landmarks of the vertebrae. So let's go to the front first. So these big bulky bits here, which are smaller at the top, are the vertebral body. And this is where your discs sit in between each one of these. So each one of these joints, because that's what they are, has a big disc, cartilaginous disc sat in them, and then this is the body of the vertebrae. So then you have your spinous processes which stick out the back here. So these are the individual ones that stick out the back, and this area here is called the laminae. So laminae, and spinous process. The other one that's useful to know and quite important is this one here, which is your transverse processes. So each vertebrae has one of these, or a pair of these, sticking out the side, along with your spinous processes sticking out the back. And these processes are sites of muscle attachments. You have an awful lot of small muscles around the spine area here to help you to be able to move it in such a controlled way, really. So that's kind of your bony landmarks, and in the seminars we will touch more on the anatomy of the spine just to clarify it for you. So next I'd like to look at a couple of joints of the spine. So you have something called a facet joint, which are in pairs, and they're just in here. They're not very big joints, but they're synovial gliding joints. And they can have a habit of getting stuck, and when they do it can be quite painful. So there's a couple of conditions we mentioned later when you go through those associated with these facet joints. They're quite small, just in here, and they're a gliding synovial joint. The other one is the intervertebral joint. So in between each of these bodies is an intervertebral joint, and it's a cartilaginous joint. And it has these big discs in it, so intervertebral discs. And these are the things that are damaged when people have prolapsed disc or bulging disc. So the outside is a thick fibrous cartilage, and it's called annulus fibrosis. So that's your outside coating. Inside is more gel-like, so this allows little movement, so it squishes around in there. And as the day goes on, we shrink a little bit because it gets squished down. But that gel is called nucleus pulposus. And what happens if there is a bulge or a prolapse is that gel is pushed out. So it's either pushed completely out through that fibrous cartilage, or it weakens an area and you kind of get a bulge in it. So obviously that's what this little thing is here. It's meant to be a disc bulge. Most commonly, but not always, it's in the lower back, because that tends to be where we bend and twist, and that's how we cause damage to the intervertebral discs, by picking up heavy stuff at awkward angles and twisting. But I do know people that have damaged the discs further up the spine, but most common in the lower lumbar section. So that's the two joints we're looking at for the spine. So next I'd like to have a look at some of the ligaments of the spine. We're going to have a look at 7. So the first one, if I turn Bob on his side it might be easier to see them, is ligamentum nuchae, and it comes from the bottom of the occipital bone to C7. And that is part of the origin for your trapezius muscle. It then becomes a supraspinosus ligament, and it carries on down to the sacrum. So ligamentum nuchae, supraspinosus ligament. Then in between each of these vertebrae, or in between each of the spinous processes of the vertebrae, right on the outside edge here, you have your infraspinosus ligament. So these are tiny little individual ligaments all the way in between each of these spinous processes. Then slightly deeper down on the laminae is the ligamentum flavum. So in between again, but deeper, coming off of the laminae, are tiny little ligaments called ligamentum flavum. So that's those. You then have your, this one's hard to show you really, your posterior longitudinal ligament, and it runs on the posterior body of the body of the vertebrae here. So it's in here, and it's a nice thick ligament that runs all the way up, and that creates the anterior surface of your spinal canal where your spinal cord runs through. Another big long one that runs then along the front of the anterior surface of the vertebral bodies is the anterior longitudinal ligament, and again that runs from top to bottom. The last one I'm going to mention is the intratransverse ligament, and that is between each of the transverse processes. Again, tiny little ligament, so that's intertransverse ligaments in there. So that's the ligaments you need to know for the spine. So I'd like to give the ribs a quick mention now. So we have 12 pairs of ribs, and they help to protect a lot of the internal organs, obviously in this area, so things like the heart, the lungs, the kidneys, things like that. And these ribs are a protective cage. There's 12 pairs. 7 of them are true ribs because they all connect directly to the sternum via these cartilaginous joints. 8, 9 and 10 connect indirectly via rib 7, so they come on, as you can see here, into that cartilaginous joint as one. And the last 2 down here are floating ribs, so 11 and 12 are classed as floating ribs because they don't connect at the front. So that's your 12 ribs, and these cartilaginous joints just allow a little bit of movement in that rib cage, just to give a little bit of spring, because you can see there's quite big sections there. On the back they connect onto the thoracic vertebrae, so rib 1, thoracic 1, rib 12, thoracic 12. So you can use the vertebrae to help locate the ribs or vice versa. So there you go. There is some information about your ribs. So as we're looking at the spinal column, and part of its job is to protect the spinal cord, I'd just like to briefly touch on nerves. So as a sports massage therapist, we don't treat nerves directly, but if you have a client with neurological symptoms, you need to understand where they might be starting from. So there is some resources in your on Moodle in your resource folders which will help you with that. But just a brief run through of the nerves. So you have 12 pairs of cranial nerves which obviously support the cranium. More important to us, we have 31 pairs of spinal nerves which help to support the rest of the body. So these are broken down into 8 pairs of cervical nerves, 12 pairs of brachial nerves, so that will come down into the arm, 5 pairs of lumbar vertebrae or lumbar nerves, 5 pairs of sacral nerves, and 1 pair of coccygeal nerves. So some of these nerves will go directly to a body part and affect it. Others will become part of a plexus before they go on to body areas. And we have 5 plexuses in the body. So the first one is your cervical. Your next one is your brachial, which will come down again, like I said before, into your arm. Then you have your lumbar plexus, your sacral plexus, and your coccygeal plexus. So that's the 5 plexus. So there's a very brief overview on your nerves, and as I said, there's more information in your resource folder on Moodle. So that's the nerves. So I'd finally like to finish with muscles. So as always, I'm just going to mention as many as I can remember and give you a rough idea of where they are. You have a full list of the ones you need to know in your manual, along with your resources on Moodle, plus you've also got your additional muscle videos as well to help you. Before I go through the list, I just want to talk about the suboccipital triangle, which is a triangle of muscles here, and this is muscles we've not covered before. So the role of these 4 muscles is to, first of all, stabilise the head and the cervical spine, but also it creates extension and rotation of those 2 structures. They're quite busy, hard-working, but very small muscles. So they are the rectus capitis posterior major and minor, and the oblique capitis superior and inferior. So they're quite important to know because they work so hard, you quite often have problems in this area. So they're ones to bear in mind. So let's run through some of these muscles, or the ones I can remember anyway. So you have sternocleidomastoid first of all, which comes from the mastoid process here onto the sternum and the clavicle, and that works the cervical spine quite heavily. You then have your scalenes in the triangle here between SCM and the trapezius muscle at the back, and these are 3 stringy muscles in here, again working or moving the head and the cervical spine. I've mentioned trapezius now, so you've got your trapezium, which comes from the bottom of the occipital bone out here onto the acromion process and the clavicle, and then down to your 12th thoracic vertebrae. So it's quite a big muscle, and that does so many different jobs. So quite often it can be called the headache muscle because it comes up into the bottom occipital bone here and pulls on things and can make it quite uncomfortable when it gets tight and problematic. You have your erector spinae group, which runs up the spine, and we've talked about that in more detail on the muscle videos. So as you're aware, it comes out in 3 different sections, but they're short sections of kind of ropey muscle which come all the way from the bottom up to the top here. So if you want to understand those in more detail, check out the video for erector spinae muscle group. You then also have your quadratus laborum in the bottom here, and this is quite a problematic muscle at times. It's very hard to access because it's very deep, and you can kind of get in here with patience towards its insertion point, and quite often I will find that very painful on people. What else have we got? So all the way up and down the spine, you've also got the small muscles, the multifidi, and then all your abdominal muscles, so rectus abdominis up the front here, your internal and external obliques, and your transverse abdominis all affect the spine. So that's your flexion movements, whereas your erector spinae is your extension movements. The other one that will have an impact on the spine because it attaches onto it is your psoas muscle. So that'll give you flexion. Here, I'm trying to think if I can think of anything else. That's the majority of the muscles associated with the spine that you need to know for your course. So that's everything now covered for the anatomy for the spine, along with your resources and your manual and your extra muscle videos. So you can now go on and complete the quiz associated with this and then move on to the next section.